no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're back talking about new people and new cases and how we can learn what's going on in New York and what's going on in the world and what's going on with each human being. We had one gentleman who came in, a 63-year-old Hispanic man from Puerto Rico, single, 4 children, who was diagnosed last year with prostate cancer. He had a biopsy by his doctor in Brooklyn, and then he was sent 50 miles away for CyberKnife. He didn't know why. He said, "Doc, isn't there any place I can get treated in New York?" He said, "No, you have to go out there." And the patient was suspicious, and so he had no treatment. And he went back to his doctor this year, and the doctor said, "Oh, it's time to do another biopsy." Well, the patient didn't know what to say, and so he had another biopsy. Now, think about it. He had a biopsy of his prostate 1 year ago. There was cancer. He had no treatment. Now, what do you think happened to his prostate that had cancer, that had no treatment a year ago? Yeah, you're right. There's still cancer there. So why the heck would someone do another biopsy when you already know there's cancer there? Send them far away for treatment when there's, I think, the best treatment for prostate cancer, you know where, Radiosurgery New York, and you can look at our booklet and we'll send it to you at no charge, and you can compare our data to famous hospitals in New York, Boston, Philadelphia, Baltimore, Loma Linda, Chicago, Texas. Yeah, comparison. You can look at your variables and see where you want to be treated. And, of course, only the places that have the best results dare to publish their results. So some places say, "Oh, yeah, we do great, slap you on the shoulder, you're going to do great." But that's not fact. So we've had data managers for 25 years following the patients, spending millions of dollars collecting data, following data, having computers and staff. And that's how we can report the data to you, and that's why it's so important. So we think if you go to a place that's proud of the data and has collected their data and compares the data, it's all in your favor. So for this man, why the heck does the urologist would do another biopsy a year after you already had cancer diagnosed with no treatment, being sent far away when you could have I think better results, more proven over more time. I think that's what most people would want. There was a report about liver cancer this week as well, and a suggestion that increased screening for liver cancer in people with cirrhosis. Now, cirrhosis is a scarring or sickness of the liver. It can be from alcohol. It can be from hepatitis, and it can lead to liver cancer. So if you or a loved one have cirrhosis, you may want to get screened. And a review of 47 studies that included 15,000 patients found the survival rate for those screened with ultrasound scans and blood tests was 51% compared to 28% who were not screened. So obviously, you'd rather have a survival rate that's double than half. And if the screening is only an ultrasound and a blood test, wow, it's easy screening to save a lot of lives. So, of course, the people that were screened were more likely to receive treatment for their cancer, and they were probably found earlier and have effective treatment. Now, there's a lot of different treatments. There are chemos, there are surgeries, there's liver transplants, there's radiosurgery. We do treat liver cancers, and we do so quite successfully. Liver cancer is the third leading cause of cancer death worldwide. And people with cirrhosis are at an increased risk. And about 3 to 5% of people with cirrhosis develop liver cancer every year. So it's something to think about if you or a loved one have hepatitis or cirrhosis. There's new treatments out for hepatitis, and there's screening for people with cirrhosis. If, God forbid, you have the development of a cancer, early treatment is better than late treatment. And here's a man we spoke about last week. He's a 91-year-old married man with 2 children. He came to me last week with a 15-year history of prostate cancer. Now, 15 years ago, it means he was 76. He was diagnosed with prostate cancer. His PSA was 15. So 15 years ago, and PSA 15 is easy to remember. And I guess he said, I was 76, and they told me I had prostate cancer. I thought, what bad thing can happen to me? So he chose no treatment. And we've talked about it recently, how people that have no treatment tend to die earlier and have more cancer deaths than those people who are treated. There's even a randomized study to show that people who get treated live longer than those who don't get treated with prostate cancer. So if you have prostate cancer and you're listening to this and you haven't got treated, you might want to give us a call at 212-CHOICES, 212-CHOICES, and talk about the data. Anyway, so this man comes in. His PSA went from 15 to 20 to 40 to 60, and now it's 3,000. Yeah, you heard right, 3,000. The cancer's in the bone. He had terrible shoulder pain last week. He was using a heating pad 5 times a day. He said, oh, doc, it's not bad. I just put on the heating pad, and it goes away. And then 10 minutes later, he puts on the heating pad again. I said, that's not going away. It's just heating up your skin so you have pain from the heat. And when the pain from the heat goes away, the cancer pain starts acting up. So it came in, and one day we arranged for radiosurgery. We arranged for a bone scan and a CAT scan to see exactly where the cancer was and is. And sure enough, in the shoulder is exactly where the most intense cancer is. And he was so afraid of radiation. He says, oh, radiation can hurt my tissues. And I said, that's why we developed stereotactic body radiosurgery, so we can focus the treatment on the cancer and avoid harm to your healthy tissues. That's exactly why we did it. Yeah, we don't want to treat your healthy tissues. We want to treat the cancer. And I made diagrams and showed him all the beams come in like Star Wars from different angles, and they all converge and hit the cancer. And you don't have to worry about the healthy tissues. They're going to stay healthy. So I was on a Friday, and on Monday he came in for treatment this week. First treatment, outpatient therapy, takes 15 minutes. You come in, beams move around the cancer, don't feel anything. He got up. He's 91 years old. He got up. He's spry. He came back on Thursday, And he came back, walked up to me with a bottle of homemade wine, just like they would make in Greece, where he's from. And he said, "Doc, I want to tell you something. The pain has totally gone away." And he was so happy. One treatment, 15 minutes. The pain is gone away. This pain that's been there for 5 years that would never leave him. One treatment, the pain has gone away. And he is so happy, and he now understands not only the theory of radiosurgery, but in practice how we can focus the beam on the cancer, hit the cancer, make the pain, make the cancer go away. He is happy, and maybe there's only one person happier than him, and that's me. So it was great to see great results for this man, 91 years old, who sadly didn't get treated 15 years ago, but we're going to treat him now. I believe he has the confidence to proceed and get good treatment and hopefully get him into remission. So thank God for trust and communication and a friend who sent him to me. There's a news article, another article this week, more information, and it was entitled, "When Hospitals Buy Medical Practices, Insurers, Patients Pay the Piper." A new study gives ammunition. This is an article written by Phil Galitwitz from the Kaiser Health News. A new study gives ammunition to what health economists and health insurers have argued for years. When hospitals buy physician practices, the result is usually higher prices and increased spending by insured patients. The study was published in Health Affairs, was based on analysis of 2.1 million hospital claims from 2001 to 2007 and analyzed by researchers at Stanford University, who found that prices were most likely to increase when hospitals bought physician practices. This is as compared to when hospitals just had a looser relationship with doctors but didn't buy their practices. They go on to say hospitals have been increasingly buying physician practices for the last decade, arguing it helps them coordinate care and control costs. But insurers and many economists say the hospital's main motivation is to get higher prices and build referrals to grow admissions. And admissions is how they get a lot of their money. So is it money, 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 money? It seems to be money, 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 money. The FTC, Federal Trade Commission, had a victory in January when a federal judge blocked Idaho's largest hospital from buying the state's largest physician practice, which would have given them 80% of all doctors in Tampa, Idaho. The FTC fought the merger, arguing that it would drive up physician prices. The federal judge ruled the hospital could improve quality by working closely with physicians without buying their practices. The message is that when doctors and hospitals merge, it may not be in your best interest. Hey, what are we talking about here? Your best interest. Your best interest. So think about it. Think about your private independent doctor, and you're his boss. You go to a hospital, and he's got another boss. And don't you want your boss to work for you and your health? Isn't that the goal of it all? So we're live. We're at WOR, 800-321-0710, 800-321-0710. I think it's time for the man with the golden voice, isn't it?
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next. at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
WOR.